Gina Haspel's confirmation for CIA director, meantime, Senator, appears likely. The Senate Intelligence Committee voting 10-5 yesterday to recommend her for that job. When can you expect a final vote, Senator? And we've got, by our count, 5 Democrats on board with yays.
I'm actually meeting with her here in about 3 hours. I've looked at all of the classifieds. I've gone through both the Minority Report's accusations as well as the response from the CIA. After that, I asked for a personal meeting with her. That's been granted. I'll be meeting with her here in a couple of hours. I think the final passage will be this afternoon, and I'm confident moving forward that she will be the next chief. From Senator, my position, I just simply want to ask her some questions specifically about what she's learned from all this.
Senator, you are a yes, right?
At this point, I'm a leaning yes. I still want to have my final conversation with her first.
And what are you looking to get from her to get you to that yes?
I remember in 2002, when I had just been elected and not yet taken the oath of office to become governor of South Dakota, I went to a governors-only meeting with the governor at that time, Governor Bill Janklow from South Dakota, along with most of the other governors in the United States, and a private meeting with Tommy Thompson, who at that time was Secretary of Health and Human Services. The message we got then was sobering. It suggested very strongly that Saddam Hussein had biological weapons, he had chemical weapons, and that we could very clearly expect that he would not be afraid to use them if he could get them into the United States. We just had 9/11. We'd just seen the loss of life. We were expecting at that point that there would be not a matter of if, but when an attack would once again take place in the United States. That's a very sobering time frame, and we forget sometimes that we had the CIA and others involved in doing everything they could to protect our country. They needed good information. When that happened, and as they were moving through, the CIA found themselves to begin with in a position that they were not prepared for, and that was the expectation that they would expedite the retrieval of information from another of possible suspects that could help stop nuclear attacks. What I want to know is Gina Haspel was right in the middle of it. I want to know is what did she learn from that experience? What did she come away with? We all learned in that experience. Not all of it's good, but most certainly we can take away some things from it. I want to know what she found out.
I want to move on really quickly, Senator, to caring for our veterans. Often overlooked and ignored. The House overwhelmingly passed a bill yesterday that does expand veterans' access to private care. Do you support that effort? Because there have been hitches and glitches when in the past when the VA has tried to do this, that you access to private care into multi-hour call waits when people were dialing 800, veterans were dialing 800 numbers trying to get doctor referrals.
Actually, in this particular case, there are several pieces of the bill that are good, but this takes away choice for veterans. At this point, I am not in favor of the bill in its current form, and I'll share with you why. While they have suggested that the idea is to improve care for our veterans, there were certain guarantees that Congress wrote into law. Number one, if you had to wait more than 30 days, you get to go to the doctor of your own choice. That is eliminated in this bill. Number two, if you are more than 40 miles away from a VA facility, 5 states retain the protection, 45 states lose that protection in the next 2 years. And finally, when it comes to looking at doctors, the doctor of your choice, it's with a veto from an employee of the VA looking over your shoulder. It says that you do this in conjunction with the VA, but that means that a VA person gets to make the final decision because it has to be a joint agreement. So at this stage of the game, I'm not real happy with that. In addition to that, there is a BRAC, an asset review of VA facilities that's included in this. That's got a number of us, particularly in rural states, that are concerned about what they intend to do. Until such time as I see the VA actually providing real service for veterans, I'm very concerned. The problem is there's some really good pieces in this legislation as well with regard to caring for veterans who were pre-9/11 in terms of their needs, and also providing some additional assistance to caregivers to veterans. So they've taken some very good things that I'm strongly supportive of, but they've mixed in some very difficult decisions for us to make about giving those veterans true choice.
Senator Mike Rounds, thank you so much for that. Our veterans deserve the best care. We will see you soon, Senator.
Absolutely.
We'll be right back.